All right, let's dive right into this explainer. We're looking at a pretty fascinating shift happening right now. Why so many professional men in Muscat are quietly upgrading their smiles. And the keyword here is absolutely quietly. We're talking about getting work done without actually looking like you had work done. Let's break down how this whole trend is completely reshaping dental aesthetics. Now, you might be wondering, isn't cosmetic dentistry mostly for, brides and magazine covers? Well, marketing and those glossy glamour shots have totally trained us over the years to think that way. But when we actually look at the data and what local clinics are reporting, the research clearly shows guys care just as much about how their smile impacts their professional and social presence. I mean, the biology of teeth doesn't care about gender, right? What's actually changed isn't the science. It's that men finally have the confidence to just go in and get it sorted. So here is our roadmap for today's explainer. We're going to cover 1. The quiet confidence trend, 2. Designing a masculine smile, 3. Popular treatments and costs, 4. 5 steps before consulting, and finally, 5. Maintaining your natural look. All right, jumping into section 1, the quiet confidence trend. The really crucial point here is that these male patients absolutely are not looking for some total Hollywood makeover. Nobody wants those blindingly bright, perfectly uniform teeth you might see on television. Instead, they're asking for super subtle, tailored treatments. It's about fixing very specific insecurities, maybe just a single chipped tooth from a sports injury or some stubborn coffee stains without drawing any obvious attention. It's literally just about looking like a healthier, sharper version of yourself, not a visibly different person. Moving right along to section 2, designing a masculine smile. A poorly planned smile can end up looking totally generic. But here's the thing. That's actually a design choice, not some unavoidable side effect. Notice how keeping the incisal edges a bit squarer and making the canines just slightly more pronounced perfectly complements a broader male jawline. It completely shifts the result from a generic, copy-paste template to a highly tailored look. Dentists actually prioritize proportion over perfect symmetry in these cases. They purposefully keep minor natural variations so the teeth don't end up looking like artificial dentures. It's a real game changer. And going hand in hand with that, selecting a slightly warmer, natural shade over a blinding bleached white is the absolute easiest way to prevent your dental work from looking overly obvious. Dentists who really know male aesthetics will deliberately steer you toward a warmer tone that just naturally matches your skin. Because at the end of the day, the goal is for people to think you look healthy and well-rested, not like you just walked out of a dental clinic. Okay, let's talk numbers. Section 3, popular treatments and costs. This is great because you can actually start with low-cost, low-commitment options, like professional whitening or composite bonding for a chipped tooth, and you don't need a massive budget to do it. Notice how the commitment level scales depending on what you need. You could literally fix a sports injury on a front tooth for somewhere around 50 to 150 Omani Reals. That's a single visit, zero anesthesia, and you're done. You really only need to scale up to the pricier stuff like porcelain veneers or a full course of clear aligners like Invisalign if those smaller, quicker fixes don't fully solve what's bothering you. Which brings us to the core focus of this explainer. Section 4, 5 steps before consulting. I want to highlight this quote because it is a critical takeaway. You do not need to commit to a massive, expensive plan right out of the gate. So many guys assume that fixing their smile means signing up for a full, bank-breaking makeover, so they just keep putting it off for years. But honestly, a short, simple chat is usually all it takes to find a very targeted, cost-effective fix. So here is your 5-step playbook to take total control of that consultation. First up, name the actual issue. Don't just walk in and say, fix everything. Be specific. Say, hey, this one chip right here bothers me. Specific complaints get you cheaper, faster plans. Second, bring close-up photos of your smile. This speeds up the whole shade and shape evaluation tremendously. Third, ask them directly about male smile design. Hitting them with that exact phrase instantly filters out the clinics that just rely on a generic, one-size-fits-all approach. Fourth, and this is big, rule out nighttime grinding right away because that completely changes the materials they'll need to use. And finally, step 5, always start with the smallest reversible option. See a meaningful change first before you commit to anything permanent. Keep these 5 steps handy, for sure. All right, last step. Section 5, maintaining your natural look. So once you've got that upgraded smile, protecting the investment is actually pretty straightforward. Aside from your normal everyday hygiene, your primary job is protecting the dental work from nighttime grinding with a night guard. Grinding is literally the #1 cause of early chipping, so don't skip that. You also want to avoid staining right after a treatment, so hold off on the dark tea, Ciroc, or smoking for the first week or two.
And please, I'm begging you, absolutely do not use your front teeth as a Swiss Army knife. Using your teeth to rip open packaging or pop bottle caps puts direct force exactly where bonding is the most vulnerable. Just stick to these rules, keep up with your twice-yearly checkups for simple touch-ups, and the whole shebang will last you for years.
So, we've gone through the science, we've broken down the costs, and you've got a very clear 5-step playbook for your consultation. Knowing just how simple, tailored, and cost-effective this process actually is, if a subtle change could seriously upgrade your professional confidence, what is actually holding you back from making that first appointment? Something to think about. Thanks for tuning into this explainer, and we'll catch you on the next one.